Hi everyone, welcome to the next video lesson where I'll practice with you. I'll practice with, what's her name? I'm really sorry, I forget your name. Okay, I was on the 28th video and now it's the time for 29th video. Okay, 18 minutes long.
Today's video is going to be interesting, guys. It's going to be somewhat similar to my Speak English with Me videos, except this one is not a dialogue. We're going a little bit old school today. But hey, listen, if something works, it works. We're going to be listening and repeating essential phrases and sentences for everyday communication. And the format we'll be using is kind of the old style tape recordings. It's like shadowing, except that it's ready and served to you on a silver platter. You don't need to search for someone to shadow. You know that I love shadowing and you know that it works, yada. I'm not going to explain this in every single video. The old school listen and repeat method is actually super useful for learning English. First off, it helps with pronunciation and fluency. By listening to native speakers and repeating what they say, you start to pick up on the correct pronunciation, intonation, and rhythm. It's like you're training your ear and mouth to work together and making your speaking style sound much more natural. It's also great for understanding and remembering stuff. When you repeat phrases and sentences aloud, it sticks better in your memory. You're not just hearing the language, you're actively using it, which makes it easier to remember vocabulary and grammar. Another big plus is confidence boost. Practicing by listening and repeating gives you a safe space to improve without the pressure of talking to someone else right away. You get to practice as much as you need to feel comfortable, and if you pair it with reading, it can even help you with reading fluency. Listening to recording while following along with the text helps you understand the flow and pronunciation of the words as you read. Overall, regularly using the listen and repeat method can really make a difference in your English speaking skills. Not to mention that it's a very easy way to practice that will enable you to use these pre-made phrases in real life right away. And the theme of this video is shopping and transactions. Our sentences for today will be simple. No slang, no tricky phrases or sayings. Just something simple that everybody says and understands and that is easy to use. Now, before we jump into the practice part, let's take a quick little break to talk about the sponsor of this portion of the video, Quillbot. I know, shall we? Repeat after me each time. How much is this?
How much is this?
How much is this?
How much is this?
Excuse me, do you have this in a different size?
Excuse me, do you have this in a different size?
Excuse me, where can I find the fitting rooms?
Excuse me, where can I find the fitting rooms?
Excuse me, where can I find the fitting rooms?
Excuse me, where can I find the fitting rooms?
Do you accept credit cards?
Do you accept credit cards?
Do you take cash?
Do you take cash?
Do you take cash?
Do you take cash?
Do you take cash? Can I get a discount?
Can I get a discount?
Can I get a discount? Do you have any sales or deals?
Do you have any sales or deals? Can I get a receipt, please?
Can I get this item?
Can I exchange this item?
Can I exchange this for a different size?
Can I exchange this for a different size?
Could you please tell me what your return policy is?
Could you please tell, is there a warranty on this product?
Is there a warranty on this product?
Is there a warranty on this?
Can you gift wrap this for me, please?
Can you gift wrap this for me, please?
Can you gift wrap this for me, please?
Excuse me, where can I find the electronics section?
Excuse me, where can I find the electronics section?
Excuse me, where can I find the electronics section?
Do you have this in stock?
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 Can I order this online? Can I order this online?
Can I order this online?
Can I order? Is there a delivery charge?
Is there a delivery charge? How long does delivery take?
How long does delivery take? Do you provide installation services?
Do you provide installation services? Can I see the manager, please?
Can I see the manager, please?
Can I see the manager, please?
Where can I find the customer service desk?
Excuse me, where can I find the customer service desk?
Excuse me, where can I find the customer service desk? Can you help me find this product, please?
Can you help me find this product, please?
Do you offer any loyalty programs?
How
do I sign up for your rewards program?
How do I sign up for your rewards? Excuse me, is there a price check station around here?
Excuse me, is there a price check station around here?
Excuse me, is there a price check station around here? Are there any additional fees?
Are there any additional fees? Do you offer student discounts?
Do you offer student discount? Excuse me, can you help me find the nearest ATM?
Can I pay in
installments?
Can I pay in installments?
Can I pay in installments?
Can I pay in total?
How much is the total?
Is there an extra charge for using a credit card?
Is there an extra charge for using credit card? Using a credit card.
Can I get a bag for this, please?
Can I get a bag for this, please? Can you recommend something similar?
Can you recommend something similar?
Can you recommend something similar?
Can you show me how this works, please?
Can you show me how this works, please?
Is this available in other colors? Do you have any samples?
Do you have any samples?
Do you offer any financing options?
Do you offer any financing options?
Do you offer any financing options? Well, that'll be it for this video. If you liked it, please give it a like so that YouTube knows people enjoy it. And if you found it useful and want more videos like this one, please let me know in the comments. And
next,
today, we'll touch on a vital topic and learn essential and potentially life-saving English vocabulary.
Okay.
And it focuses on emergency room vocabulary, but it is not limited to use only in emergency rooms. You can use it when talking to any doctor. This is very important because it can help save time, which can literally save your life and money, as doctors might perform unnecessary tests and procedures if they can't understand your concerns, leading to an increased bill. And you might want to take notes for this one. So, without further ado, let's jump right in. When you arrive at the emergency room, doctors typically ask questions to quickly assess your condition. These often include questions like, what is the reason for your visit today? When did your symptoms start? Have you experienced these symptoms before? Are you currently taking any medications? Do you have any allergies? Do you have any chronic health conditions? Have you had any recent surgeries or hospitalizations? Can you describe the pain or discomfort you're feeling? Have you experienced any recent trauma or injury? Do you have any family history of medical conditions? These questions help the medical team understand your situation and provide appropriate care quickly. There are also key vocabulary terms and phrases a patient can use to explain their problems and symptoms in an emergency room or ambulance setting. We'll start with describing your pain. And first of all, I want to talk about one little word that people often use when talking about pain, and that is ache. And I'm 99% sure you've heard it. So, when describing your pain, you can use the suffix ache. It is a handy way to talk about pain or discomfort in different parts of your body and is quite common in everyday language. You just attach it to a word that indicates where the pain is, meaning you should identify where it hurts. Is it the head, tooth, stomach, back, ear, etc.? For example, headache, pain in your head. I've got a bad headache. Toothache, pain in your tooth or teeth. I need to see the dentist because of my toothache. Stomach ache or tummy ache, which is pain in your stomach or belly. I have a stomach ache from eating too much. One little note, stomach ache can be written as one word or two words. Backache, which is pain in your back. Lifting heavy stuff gave me a backache. Earache, pain in your ear. Some ache words are more common, like the ones we just mentioned, while others are used less often. For example, muscle ache or heartache, however, is more commonly used to talk about emotional pain, as in this example. The breakup caused him a lot of heartache. Muscle ache would more likely refer to pain in your muscles, often from working out or overexertion. For example, after working out, I felt muscle ache all over. Using ache words helps you clearly talk about specific types of pain, which is super helpful when you're trying to explain how you feel and get some help. I am very excited to announce a brand new ache. You should definitely try it. When describing your pain, try to specify the exact location where the pain is. And for this, you can use a simple pattern. I have pain in my, and name a body part. And here's some examples. I have pain in my stomach. I have pain in my lower abdomen. The pain is in my upper right chest. You could also say, I have chest pain or I have a headache. Next, a doctor might ask you to describe or specify the type of pain. For this, you can use words like sharp. It feels like a sharp stabbing pain in my back. Dull. I have a dull ache in my legs. Throbbing. There's a throbbing pain in my head. Burning. I feel a burning sensation in my throat. Stabbing. It feels like a knife is stabbing my side. Cramping. I have a cramping pain in my stomach. The next thing to specify would be the severity of your pain. For example, you can say the pain is mild, moderate, severe, or unbearable. Then they'll probably ask you about the onset of your pain. For example, whether it started suddenly or gradually. And your possible answers might be: the pain started suddenly about an hour ago. The pain has been gradually increasing over the past few days. And remember, all these details might potentially save your life. The next thing you should mention is the duration of your pain. The pain has been there for about 10 minutes. I've been in pain for 3 hours. The pain has lasted for a week. Another question doctors love to ask is about the intensity of your pain, like on a scale from 1 to 10, how would you describe your pain? And you could say, on a scale from 1 to 10, my pain is a 7. Pain can also radiate to different parts of your body, which is important information for your doctor. When talking about pain, to radiate means that the pain spreads from one part of the body to another. The pain radiates from my chest to my left arm. Another important detail worth mentioning to your doctor is the frequency of your pain, although they will most likely ask about this themselves. The pain can be constant, and you can say something like, the pain is constant and it doesn't go away. Or it can be intermittent, and you can say something like, the pain comes and goes every few minutes. Your doctor will also likely ask if you have other symptoms they should know about. If you can think of anything else you've been dealing with recently, you should mention it, as it might be a very important piece of information for your doctor to give a correct diagnosis. And here's a list of other symptoms that one might experience and examples of their usage. The next one is chest pain. I have a tight squeezing pain in my chest.
What is the meaning of nausea? Is a feeling and urge to vomit. It is often called being sick to your stomach. Got it.
Palpitations. I feel my heart racing and pounding in my chest. Weakness and fatigue. I feel extremely weak and fatigued, like I can't do anything. Swelling. My ankles are swollen and feel tight. Bleeding. I've been bleeding from a cut on my arm for the past 30 minutes. Vomiting and diarrhea. I've been vomiting and having diarrhea for the last 24 hours. Fever and chills. I have a fever of 102 degrees and chills that make me shiver. Additional questions from your doctor might be about what triggers and relieves your symptoms. You can say something like, the pain or symptom gets worse when I move or eat, lie down, breathe, etc. Or the pain gets better when I, for example, rest, take medication, apply heat or cold. Doctors will also ask you about your medical history. They may ask you about medications you're currently taking, your allergies, medical conditions, recent procedures, and more. And here are some patterns you can use to answer these questions. When talking about medications, you can say something like, I'm taking, and then name the name of medication, or I take, and the number of milligrams, and the name of the medication and frequency. And here's examples. I'm currently taking antibiotics for an infection, or I take 10 milligrams of lisinopril daily for high blood pressure. When talking about allergies, you can say something like, I'm allergic to, and name the substance. Or you can say, I have no known allergies. And here's the example. I'm allergic to penicillin. When talking about medical conditions, you can say, I have, and name the condition. For example, I have diabetes, or I am diabetic and take insulin. I have high blood pressure, or I have a history of asthma. And when talking about recent procedures, you can use the pattern you see on the screen and say something like, I recently had knee surgery, or I had surgery on my knee 2 weeks ago. And here's other important information you might need to provide, along with patterns you might use and example sentences. When giving the emergency contact, you should be precise and specific. You can say something like, my emergency contact is, and then provide their name, your relationship to that person, and their phone number. For example, my emergency contact is John Doe, my husband. His phone number is 51234. When giving your insurance information, you can say something like, my insurance provider is, and name the provider. For example, you can say, I have my insurance card with me. My provider is Blue Cross Blue Shield. And you can also ask for language assistance if you don't speak the language. And you can say something like, I need an interpreter for Spanish, or I speak Mandarin and I need assistance. Now it's time to put what we've learned into practice.
Okay.
Let's take 3 different situations and describe them. Situation number 1, you have chest pain. I have a sharp stabbing pain in my left chest that started suddenly about an hour ago. It's constant and radiates to my left arm. The pain is severe, around 8 out of 10. It gets worse when I move and slightly better when I sit still. I also feel short of breath and dizzy. Speaking practice. Situation number 2, and read this out loud.
A sharp stabbing pain in my left chest that started suddenly about an hour ago. It's constant and radiates to my left arm. The pain is severe, around 8 out of 10. It gets worse when I move and slightly better when I sit still. I also feel short of breath and dizzy.
Speaking practice. Situation number 2, you have a severe allergic reaction. I have difficulty breathing and my throat feels swollen. I think I might be having...
I have difficulty breathing and my throat feels swollen, and I think I might be having an allergic reaction to something I ate. My lips and tongue are also swelling. I have a history of allergies to peanuts. I need help immediately.
I have a history of allergies to peanuts. I need help immediately. Situation number 3, you have abdominal pain. I've been having dull, cramping pain in my lower abdomen for the past 2 days. The pain is intermittent but has been getting more frequent. It's around 5 out of 10 in intensity. The pain gets worse when I eat or drink anything and slightly better when I lie down. I've also been feeling nauseous and have had diarrhea.
I've been having dull, cramping pain in my lower abdomen for the past 2 days. The pain is intermittent but has been getting more frequent. It's around 5 out of 10 in intensity. The pain gets worse when I eat or drink anything and slightly better when I lie down. I have also been feeling nauseous and have had diarrhea.
There are some important things to keep in mind for effective communication. Be clear and concise. Stick to the main points and avoid unnecessary details. Be honest and accurately describe your symptoms, pain levels, and medical history. And use descriptive language. The more accurately you can describe your symptoms, the better healthcare professionals can understand you and help you. By using these detailed terms and phrases, you'll be able to communicate your symptoms and medical needs more effectively, helping healthcare providers give you the best possible care. Well, that'll be it for this video. I really hope it was useful. If that was the case, don't forget to give this video a like, subscribe to...
Yep, I have been both of them. Okay, that's it for today's lesson, and I'll meet you in the next video. Bye.